Hello, everybody. Hello again. Welcome back to this week's live training. I hope you're having a wonderful day, whatever day it is. Hello to everyone that is watching, whether you're watching in the Clinical Connections Mentoring Facebook group or whether you're watching on Instagram. Hello. Maybe you're even watching on YouTube. Welcome. Thanks for being here. So happy you want to hear what I have to say today. Today's topic will be helpful for really anybody that currently you like your job, but you don't necessarily love it, really. It's for clinicians who are satisfied, but maybe they want a little bit more. It's also for the clinician that's maybe wondering, what am I missing? What else is out there? I really like where I'm at right now, but is there something better? Is the grass greener somewhere else? So that's what I'm going to talk about today. I get a lot of messages from clinicians stating that they really enjoy their current job, but they want a little bit more for their career, right? They like their job now, but they don't necessarily see themselves staying there forever, and that's okay. A lot of clinicians tell me that they like their current job, but they're afraid that they're maybe losing their skills that they would use in another setting that they might want to transition to later in their career. So today I'm going to answer that question, provide some guidance if you feel yourself asking, wondering, or maybe even pondering some of these same thoughts. Okay. So for anybody new here, anybody first time watching, listening, whatever, I am Dr. Jody Miller. I'm a physical therapist and a mentor to PT students and new grads. I've worked in just about every setting that there is for PTs, everything from pediatrics. I've done outpatient orthopedics. I have done home health. I've done travel PT. A lot of my career has been in skilled nursing facilities. I was a rehab director of a skilled nursing facility. Now I own my own cash-based practice where I work primarily with gymnasts and cheerleaders. And I'm also the owner of Clinical Connections Mentoring, which is where you are right now. So what I'd like to do, if you are watching live, please type live in the comment section. Tell me who you are, where you're from, where you're watching from. I just like to know who I'm talking to. Same thing if you're watching the replay. Tell me who you are, where you're watching from. And go ahead and tell me, have you ever felt this before? Has it ever come across your mind like, I like it. I like who I'm working with. My job's not terrible, but is there something more? Am I missing something? Am I going to lose some skills if I decide I don't want this forever and I want to go somewhere else? Right? Let me know if you've ever thought that before. So I want to start by saying that if this is you, if you found yourself thinking any of those things that I mentioned about your current job, there's nothing wrong. This is completely normal, okay? It means that you just want more for yourself. It's okay to like your job, but also want more for your career. It just simply shows growth. It's okay to start in one place and decide you want to change. This also shows growth. You just heard me. I've worked in just about every setting that there is because I had some change along the way. I had growth along the way. All of that is okay. It's also okay to like your job, be curious about what else is out there, but also be a little bit afraid, a little fearful of leaving and ending up in a worse situation because that can certainly happen, right? The grass is not always greener. Sometimes it is, sometimes it's not. So, as you grow in your career, you're going to learn new things. You're going to learn what you like and what you don't like. You're going to start to have interests in new things. New things are going to start to intrigue you. Life is going to change around you, and your priorities and your values are going to shift. And sometimes when that happens, that those priorities and values no longer match the job that you have, and that can lead to change as well. None of these things are necessarily bad because change can be good. Okay? So the next thing I want you to realize is that you will never ever lose your other skills, right? They're always going to be in your brain. You just gonna have to pull them forward, okay? But the knowledge that you learned in school or on your clinicals, it doesn't just go away, right? Yeah, you may need some refreshers, and yeah, it's going to take a little bit to kind of dust off the cobwebs, but that knowledge is always going to be there in your brain, okay? Let me give you an example. So I spent over 8 years working in skilled nursing facilities, different ones, before I decided that I wanted to start my own out of network clinic, my own cash based clinic, working primarily with adolescent athletes. So talk about cobwebs there, right? It was I had done 8 years of geriatrics. Some of that wasn't even clinical because I was a rehab director. And then I decided I want to start my own clinic and I wanted to work with adolescent female athletes. Two very different groups. So talk about the cobwebs, right? But it was all there. I just needed to spend some time refreshing my brain, right? It did take some moments of quick review to remember some of the details of orthopedics, but it was always there, right? And I've been able to help quite a few people in the past 6 years. So, if you've been working in acute care, but you want to move to an outpatient orthopedic job, do it, right? If you've been working in peds, but you want to move to acute care, do it, right? If you've been working in inpatient rehab, but you want to move to outpatient, go for it. You may just need to spend a little bit of time reviewing your old notes from school or looking up some diagnosis you haven't heard or treated in a while, or do some refresher continuing education courses, right? That's all okay. But you're gonna be surprised to learn how quick it all comes back to you because it's always there. With knowledge, just because you don't use it, it doesn't mean that you're gonna lose it. The knowledge is always there. You just gotta bring it forward, refresh yourself a little bit. Okay. So, to follow up on that, there are quite a few skills that can be used across multiple settings, right? Just because you work in acute care doesn't mean you can't use your manual therapy skills. Just because you work in outpatient doesn't mean that you can't help patients with functional mobility skills like bed mobility and transfers. Just because you work in peds doesn't mean that you can't use your orthopedic knowledge and skills to help those patients, right? Just because you work primarily with outpatient neuro doesn't mean that you can't use your orthopedic skills for those patients with neurological diagnoses, right? All patients are people, and all people have all body systems. Everybody has an orthopedic system. Everybody has a neuro system. Everybody has a cardiopulm system, right? So, you can't just because you decide to go in orthopedics doesn't mean you don't pay attention to neuro. All of those, it's all part of that person, and all of that is contributing to the person's problems. So you're always treating all systems of every patient, right? So you can use everything you've learned about all of these systems to help patients in every setting that we can work in as PTs, right? There may have been times, or not may, there have been times, right, where I have used manual therapy skills when helping someone with a stroke or even a spinal cord injury. I remember a patient, he was a lumbar paraplegic, but it happened because of a back surgery, and he was having pain above in his thoracic spine. So I did some joint mobs. We did some thoracic extension, right? He was a neuro patient because he'd had a stroke, but I was doing manual therapy and I was using my orthopedic knowledge to help him in that moment, right? There have been multiple times where I've done joint mobs for someone in the acute care setting who's having back pain, knee pain, ankle pain, right? I've used manual techniques in skilled nursing facilities for patients who've had total knee replacements. I've helped patients in outpatient with some lower level skills like bed mobility, rolling, and wheelchair transfers, right? I've done high level balance skills for patients in acute care. So just because you've chosen to work in one setting does not mean that you have to stick to those skills that are standard in that setting, right? Think out of the box. Treat the whole patient, not just their diagnosis. Nobody is just an orthopedic system. They have a neuro system. They've got other integumentary systems, right? Treat the whole patient. Working in acute care does not mean that you just have to work on bed mobility and transfers and supine range of motion exercises, doing laps around the nurse's station. It's a huge pet peeve of mine, right? We as a profession, we are capable of so much more than this in acute care. We can treat the patient's knee pain with manual techniques. We can treat the patient's balance impairments with coordination activities and dynamic gait activities. Patients in acute care are absolutely capable of doing standing THER exercise with the appropriate load and resistance, right? It is all too common. I see it way too often. Everyone just kind of, well, that's what everybody else is doing in acute care. So we're going to do some seated bed exercise. We're going to work on standing up, walk around nurse's station, and we're done. We are capable of more than that. And so if that's you, if you're working in an acute care setting and you're already thinking, oh, I like it, but I want more. I don't want to lose my outpatient skills or I don't want to lose my high level neuro knowledge, then use it, right? These patients are capable of receiving those skills from you, okay? Working in outpatient doesn't mean that you just have to treat adult orthopedic diagnoses, right? You can treat neuro patients in outpatient. You can treat adolescent athletes. You can treat low level patients who need a caregiver at home. You can treat patients with cardiovascular problems, right? Outpatient is probably the easiest one to have a lot of variety. Working in inpatient rehab or skilled nursing facility does not mean that you just have to work on bed mobility and transfers. Yeah, the focus in these settings is those big picture functional goals. We want to get them home, right? But you can still use other skills to help meet those functional goals. If orthopedic pain is limiting the patient's ability to perform functional mobility, maybe they're having knee pain and that's why they're having trouble with sit to stand, work on joint mobs to help relieve their pain. Then do sit to stand, right? Patients in this setting are also capable of performing more than bed and chair exercise with a 1 pound ankle weight. Another big pet peeve of mine. Use your knowledge of high level balance activities, multitasking gait activities, functional strengthening skills to help these patients. We don't just have to do long arc quads with a 1 pound ankle weight or a yellow TheraBand to help strengthen their quads. We do a lot more functional strengthening activities. We can do hinges, we can do squats, we can do lunges with patients in skilled nursing facilities. If they're capable, then do it. Okay. So remember, you don't have to silo your skills into the setting that you work in. Just because everyone that you work with is sticking to those skills, it doesn't mean that you have to also treat the entire person. They have more than one body system, and you are capable as a PT or an OT of addressing all of these impairments, regardless of the setting that you work in. We can be better if we all view our skills and knowledge this way. Okay. Lastly, I want to share some other ways that you can either bridge your skills beyond the setting that you're currently working in or test the waters of other settings, right? So, one of the big questions that I get a lot is, I work in acute care, but I don't think I want to be here for my entire career. I think maybe I might want to go to outpatient or orthopedics or whatever, right? But there are some ways that instead of leaving that job altogether, you might be able to create a little path for yourself, right? One way to kind of bridge your skills or test the waters of other settings is to find a company or facility that's going to let you work in multiple settings, right? This is typically going to be your bigger hospital systems, but because they tend to have all different settings, right? My first job out of school was a small hospital system, and I was hired as a rotator. So every 3 months, I would change the setting I worked in. So I worked 3 months in outpatient, I worked 3 months in acute care, I did 3 months in their sports clinic, and then I did 3 months in skilled nursing facility. And I loved it. Right. And then after my first year, I ended up transitioning to Monday, Wednesday, Friday. I was in the outpatient clinic. And on Tuesdays and Thursdays, I was in skilled nursing facility. And there was another therapist. And so we just flip flop, we shared the schedule, we flip flopped our days. And I absolutely loved that. And I did that for 2 years. I loved it because it allowed me to test out all of the settings and allowed me to use all my skills, right? And for someone who needs challenge and a lot of variety to keep from getting bored, this was an ideal job for me. It let me use all of my skills, everything that I had learned in PT school on a weekly, daily basis, right? And it just kept me, I need a lot of variety. So it kept me kind of fresh. I didn't get bored with anything. So another way to kind of test the waters is to work multiple PRN jobs that allow you to work in multiple settings. Now, this can offer you variety and a way to figure out what you like most, but I do caution you that this will only work, this type of career, working multiple PRN jobs is only going to work if you are well organized and good at setting and sticking to your boundaries. Okay. It can be really easy to work 60 hours a week with this method, which is quickly going to lead you to burnout, which nobody wants. Okay. So there's the option of working multiple PRN jobs to test the waters. Um, keep all your skills and everything if that's what you're worried about, but you have to be able to set your boundaries and stick to them and be organized. Okay. Another option is to create the job you want, right? For example, if you work in acute care, but you enjoy outpatient, or you're afraid of losing your outpatient skills, which we've talked about is not ever going to happen. But if that's a fear that you have right now, you can ask to maybe also work in the emergency department, right? Working in the emergency department is an excellent way to mesh your inpatient and your outpatient skills, as well as give yourself some variety. So you can help with triaging patients in the ED. You can help to reduce unnecessary hospital admissions for patients that come in through the ED. You can help with outpatient referrals to other placement issues. So your knowledge as a PT can say, okay, yeah, they don't need to be admitted. Let's get them an outpatient referral, right? You can treat patients with low back pain, vertigo, patients at risk for falling. You can still do all of that in the ED. You can help with DME recommendations and teaching patients how to use different assistive devices. Then you can still also float up to the floor and use your inpatient skills. The possibilities are really endless with this kind of option, right? Another example of kind of creating the job that you want is if you work maybe in skilled nursing facility, maybe you can offer to your boss or the facility to start outpatient services, right? So one, this can help with continuity care for the patient. So after you discharge your patients, then they can return to to your facility to continue working with you, but on an outpatient Part B status, right? It can allow you variety and the ability to use inpatient and outpatient skills again, right? So if you are creative enough and you have the support from your bosses and you really have the drive and the desire to try something new or to start something new, you may be able to create the exact job that you want. Okay. So to recap, if you find yourself thinking, I like my job, but I don't love it, I don't know what to do about that. First, remind yourself that it's okay. Wanting something different is absolutely okay. Think about what you do want and how can you solve that, right? Are you limiting yourself by certain beliefs or because that's what everyone else is doing? Remember, you don't lose your knowledge and skills. They may just need some dusting off, cleaning off those cobwebs, okay? Ask yourself, can you make a small change to your current job? Can you are there skills right now that you're not using, but you are capable of using, regardless of the setting that you're working in? Remember, all skills can be used in every setting, okay? Can you make a big change to your current job, like creating the job you want by asking your boss, can we just simply build something new at this facility? I'll be the lead. I'll take the lead on it. Let's create the job for me. Okay. So really there are a lot of options, which is a great thing about our profession and you are certainly capable of loving your job. So if you like your job right now but you don't necessarily love it or you think there might be a little bit more, that's okay. You might have to create a little bit, but you are capable of loving the job that you have. I hope you learned something new today. Please go ahead and drop in the comments your aha moment or something that really stood out for you, something new that you learned today. I want to thank you for watching, whether you're watching on Instagram, whether you're watching in the Facebook group, or whether you're watching on YouTube. If you have any questions about anything that I talked about or anything I mentioned today, please feel free to message me or just leave your questions below. I will definitely come back and answer them. Hope you have a great day. See you next time.